Good evening, everyone, and welcome to the University of Michigan School of Public Health Graduate Prospective Student Discovery Series. I'm Mary Beth Carroll, and I work as the Assistant Director of Student Affairs within the Office for Student Engagement and Practice. My pronouns are she, her, and hers. I hope that you enjoyed the introduction video sent in your reminder email from Dean Bowman. This evening's programming will focus on our Environmental Health Sciences Department. Now more than ever, the world needs public health, and public health needs you. Tonight, we'll talk about the field, program design, and what life is really like at Michigan Public Health. During our programming, you'll have the opportunity to ask questions throughout the chat box, so please don't hesitate to ask them throughout the evening. We'll also leave time at the end as well. You'll also be able to engage with some staff, faculty, and some of our wonderful current students as well. Here at Michigan Public Health, our mission is to pursue a healthier, more equitable world through education, research, and action. We work with compassion, innovation, and inclusion to create a meaningful and lasting impact. And when you think about it, public health is really all around us. It's the quality of the air we breathe. It's the flu shot you're probably getting right now at the pharmacy. It's the ethics of genetics testing, and it's even the creation of the policies that govern our healthcare system. If you hear about public health in the news, which you're probably hearing about pretty frequently right now, it's likely that there is a public health angle to what you're hearing. So really, the common denominator here is that everything we do in public health is about improving the health of people at a population level. As a graduate of the University of Michigan, you become part of one of the world's largest alumni networks. And this degree will give you worldwide recognition no matter where life takes you. As a Michigan Public Health student, you'll join a top-rated program and a long-standing tradition of excellence. Our history dates back to 1941 when the school was founded. This is where Blue Cross Blue Shield was created, the National Sanitation was founded, it's even where the first Earth Day was held, and it's where the flu mist was invented. The polio vaccine was proven safe, potent, and effective at the University of Michigan School of Public Health. The University of Michigan and the School of Public Health have consistently earned top rankings for the programs and resources that we offer. At this time, I'm going to turn it over to Dr. Olivier Juliette. He's a professor within our Environmental Health Sciences Department, and he's this year's recruitment chair as well. I wish you the best of luck with your evening tonight, and we look forward to connecting with you soon. Thank you.
Thank you, Mary Beth. So thank you, warm welcome in our department. So I'm Olivier Joliette. My French accent is not from France, it's from the French-speaking part of Switzerland. So you can see my mountains. I came here in Michigan 15 years ago because of you, I thought as a public university, as students, you were really cool. I went to Stanford also. It was much, if you like, quality was there, but we don't necessarily need to show off. And that's one quality we have. We want high quality, but we want it to be recognized by others, not by ourselves. And our department, I think, is a really interesting one, full of passion, bringing these two sides of environment and health together. Let's, perhaps Laura, if you get to the next slide. Let's introduce each other. We don't want to go around everybody, it would be annoying, but these are the people who register, you who registered, where you are from. Of course, they are some from Michigan, Ypsilanti, Ann Arbor, Saginaw, Grand Rapids, but we see people from Djibouti, from Mexico City, Karachi, San Jose, in Berkeley. That's really nice to have all this diversity. It's in a sense a privilege of the COVID time where we sadly cannot meet, but on the other hand, it enlarged the room of what we can reach and do together. In terms of major, Laura, next slide. Also a good diversity. There is, of course, some environmental health and public health, but biology, environmental science, quite a bit, studies in the environment, international, global, and then also, medical, medicine, pre-medicine, engineering, architect, some anthropology. It's really nice to see the interest that you have. And in terms on the bottom left, you have in fact what you are presently doing. The 5 is in fact professional, having been active less than 5 years. There are quite a few. Of course, some undergrad, but also graduate quite a bit. Senior, mostly some junior, but some working professional all together. That's really nice to be together. So next slide. So let's present ourselves as faculty and I would say team working with you to train you in environmental health. I put in the center here environmental health as the science of prevention and understanding causes. I think it's really the question we are answering in environmental health is why. And why we ask that, because we want not only to know that there are some damages done at the environment, damages on health, but we want to understand why, and so that we can prevent it. And just to see an example, in our department we're working and we are teaching. You will be exposed to all of that, starting from the driver at the bottom here, the electronic waste, where our colleague Rick Neitzel is working them. Laura Rozick and her students and collaborator has been working and sampling the environment, and here we monitor, we prevent the environmental impact, which then can lead to exposure either from workers. And with us we have Aurora Lee, who's just been hired in our department for how long, Aurora? Like 2 months? 2 months. And she's working on preventing exposure to communicable disease, which you can think is important work just presently in our COVID time. Then we look at the consumer and the exposure of the kid. This is my postdoc kit for a paper we're publishing just today, in fact, on a high screening throughput of toys, and realizing that a kid receives about 18 kilo plastic per year. So if they keep them 3 years, you have at least 50 kilo plastic. And that means quite a few exposure that we have indoor. And then once we have exposure, we understand and mitigate health effects and work on that. And so as good science and good teaching goes with interesting people, I would like to introduce now our department head, our department chair, Dana Doliloy. And Dana, you will say a few words of welcome, perhaps also what is your passion with the health. Dana is working beyond being the chair. She's working and is a world leader in epigenetics. Dana.
Thank you, Dr. Joliet. Good evening, everyone, or morning or afternoon, depending on where you're staying safe. As Olivier mentioned, my name is Dana Delanoy, and as chair of the Department of Environmental Health Sciences, it's my pleasure to welcome you to the School of Public Health Discovery Series and to the Department of Environmental Health Sciences. As you know, today's event looks a lot different from our previous graduate student Prospective Student Days, but that does not dampen our enthusiasm in meeting you and sharing our department's programs and admissions processes with you. In fact, as Mary Beth mentioned, now more than ever, we need public health trained environmental health sciences. And we need researchers like you to help combat some of the most pressing human health issues, from the exacerbation of diseases, including COVID-19, for example, to air pollution, to understanding why environmental exposures disproportionately affect some subpopulations more than others. As those of you know me, I grew up on the coast, actually in Huntington Beach, where I saw one of you is from in the Wordle. So this sparked my interest in ecology, climate, and health. And 12 years ago, I moved away from the coast here to the Great Lakes, and I've discovered that there are lakes both big and small, and there are so many both things to do to balance both physically and mentally. And this summer, I've really taken to paddleboarding. As Olivier mentioned, my own research is in the area of toxicoepigenetics and nutrient-toxicant interactions. So can we do things in our diet to help mediate against the effects of negative chemical exposures? It's so exciting to see so many of you here on the Zoom call. You hail from near and far, and you represent such a wide variety of majors. Our department is comprised of about 80 students across our master's and doctoral programs. EHS is home to 7 administrative personnel and over 40 research and center staff members. And the EHS faculty that you'll meet here today consist of 22 core faculty across our tenure, clinical, and research tracks. And we also have several jointly appointed faculty, lecturers, and adjunct faculties. As we hope to convey to you today, our Environmental Health Sciences Department and our School of Public Health are all about developing passions. We want to cultivate cross-disciplinary and innovative solutions to problems. And here in EHS, we aim to protect our global populations where they live, work, and grow. And our students are prepared to lead in sustainable action, shape public health policy, pursue jobs in public health practice, academia, advocacy, medicine, and beyond, as I'm sure some of you will show us. And finally, we have a commitment to creating a diverse and equitable inclusive community for all of our students, staff, and faculty, where all individual voices are heard, welcomed, and respected. You are meeting at us a very exciting yet unique, challenging time. And some of the exciting developments include our relatively new dean, Du Bois-Bowman, who has been committed to opening our School of Public Health Safety for all of our students, faculty, and staff, while remaining committed to new learning and research initiatives, including combating racism as a public health issue. We have several new and continuing initiatives here in our department, including a new unified curriculum, many different departmental research centers and training grants in occupational and environmental health sciences. And there's also a new university commitment to an investment in the biosciences. Before I turn the presentation over to my colleague, I'd like to extend an invitation for any of you to follow up with me with questions as we proceed throughout this admission season. I look forward to getting to know you. And with that, I'd like to turn the Zoom podium over to my colleague, Associate Professor Laura Rozick, who will share with you more in-depth information about our programs and admissions processes. Thank you, Laura.
Hi, everyone. I am Laura Rozick. I'm Associate Professor of Environmental Health, Global Public Health, and Nutrition. I also am the Director of the Center for Southeast Asian Studies in the International Institute, and I'm so excited that you came to learn about the department today. I love being in the department. I'm a molecular epidemiologist, and I really feel like there aren't many places in the country where I can do what I do. My work spans from cohorts in New Orleans, Louisiana, Detroit, and here at the University of Michigan that look at cancer, to new projects that we have that look at stateless people on the Thai-Myanmar border and their access to health and environmental effects on their health. And really, that's what I hope you see from this slide Professor Joliet put together. That really one of the great things I think about working in environmental health is not only do we look at the associations, not only do we look at the associations between health and environmental effects, but we really strive to look at the why and the mechanism under which. And again, I feel like this is a great opportunity for you to take a look at our program and see if this is a good fit for you. So with that, so why should you do environmental health sciences at the University of Michigan? This is the obligatory slide where we tell you how wonderful we are, which of course we are, but I think there are some highlights that make it particularly advantageous. We have an 8-to-1 student to faculty ratio, which is great for students, but I think it's also great for faculty because we're able to interact on a really personal basis with a lot of our students. And I know that often students will just come into my office or now into my Zoom room and we can talk about plans they have or maybe talk about classes that they may want to take. And since most of our faculty work around the entire campus, I feel like all of the resources at the University of Michigan are open to you in this way. And if your parents or family or anything like mine, they're going to ask if you get a job when you leave Michigan, you will. 97% of our 2019 graduates are employed or are pursuing an advanced degree with very high job satisfaction. We have a large alumni network that you're able to take advantage of. The entry level salary for our graduates seems really high to me, but I'm about 100 years old, but it's a good degree to have. We have the #1 public research university and the #5 School of Public Health. And you may have noticed my accent as well as Professor Jolier's. I have an Ann Arbor accent. So I grew up about 2 miles from here, and I have the Midwestern accent to prove it. But I will say that we don't go a lot into Ann Arbor. And of course, we're happy to answer questions about the city of Ann Arbor. It's a really great place to go to school. People ask if they mind the cold, and I just look out my window right now at fall, and I would not trade fall to anything. The arts, the restaurants, everything that you can enjoy in Ann Arbor. And I am a glass half full person, and I am positive that we will be enjoying these again soon once we are past this pandemic. Talking a little bit more about job placements, one of the nice things about our department is the range of degrees that you can get, but also that these will lead you to different types of jobs depending on what you'll want at the end of your 2 years. Many of our graduates are in industrial commercial firms. Many work at universities or colleges, including the University of Michigan and universities around Michigan, nonprofit organizations, consulting, federal government, health insurance. We have a few that go into pharma and biotech and into the military. And you'll see here, which I believe is on your right, at some of the many companies that our students have worked at and continue to work at. And I know I keep in touch with a lot of my former students and my former advisees. And again, it's been, they really have a lot of job satisfaction with what they do. When you're working to improve the environment and inform people about the environment, you really have a lot of passion and job satisfaction.
Perhaps I would encourage you, if you have questions, you can already put them in the chat.
Oh yeah, put them in the chat, please.
We'll look at them. So once Laura is done, but you can write them in case of. Laura, go ahead.
Sure. So so that ends the commercial portion of our talk, but let's talk a little bit about the degree options, because I think it's probably worth thinking about. If you come to the Department of Environmental Health, the type of degree you'll want to get. The traditional Masters of Public Health is something we offer in environmental health sciences. It's focused on professional skills and knowledge. We do have a required internship component, which is of course evolving with COVID, but it is there. These internships often lead to job opportunities and are generally really great for the students. And these are designed to prepare you for a more environmental health science-based professional career. Now, if you're like me, when I got my master's degree, which I got at the University of Washington, I was pretty sure from the beginning that I wanted to do a research career and obtain a PhD. And for people like that, the Master's of Science degree is a good choice. This can take 3 or 4 semesters, depending on how you build your program together. There's fewer course requirements, and a focus on research and research in the lab, and a required thesis through the Rackham Graduate School. Most people here are interested in the master's degrees, but of course we have the PhD program, which takes about 3 to 5 years. This is like a traditional PhD program, which is research focused, has high expectations for academic research achievement. There's some required courses. The nice thing about being at Michigan is you can take courses throughout the university, and many of my PhD students have taken advantage of this, which really can help round out your degree. And this is really designed for students for a research-based career. So in our MPH in Environmental Health Sciences 4 semesters, it involves a common core in exposure science and health, toxicology, occupational and environmental disease, and then integrated approaches and professional perspectives in environmental health. I'll note here that there is a degree in environmental epidemiology that's offered through the Department of Epidemiology, though, again, I'm an epidemiologist who does environmental health. And this would be an appropriate degree to come to environmental health sciences if you wanted to also focus a little bit on the essentials of toxicology and exposure science. So it's a slightly more mechanistic degree if that's what you'd like to design. Again, there's the internship instead of the research thesis, and it requires about 60 credits. And again, I've had students who have taken different courses around the university, and it's even though it seems pretty prescriptive, it's a relatively flexible degree. So you can specialize in different aspects in our department, such as toxicology. I mentioned occupational environmental epidemiology. There are a number of you here who are interested in our industrial hygiene program, which is a very popular and rigorous program to train you as an industrial hygienist. I think it's a great degree. I tell my kids all the time they should do it. I think it's wonderful. And then environmental quality, sustainability, and health, which is another specialization. And Professor Jolie, I can talk a little bit to you more about that. All of these, again, just depending on what you're interested in when you come to the Department of Environmental Health. Another degree we're very excited about that's a few years old is our MPH in Environmental Health Policy and Promotion. This is a new degree. It's been very popular. And this combines not only environmental health and the mechanisms of environmental health, but also the health behavior and health policy to prepare you for a career where you take this integrated field and address health policy and health behavior in your profession. And it's another really great way to do environmental health if you're really interested in the policy and health behavior aspects of this. Again, this is another MPH degree that would take 4 semesters. The Masters of Science in Environmental Health, again, you can have a concentration in anything in which you're interested. Most students are either environmental health sciences, either industrial hygiene, EQSH, or general environmental health, or toxicology. You'll complete your research thesis, again, fewer didactic credits. And you can finish this in 3 semesters with a focused research project. I wanted to quickly touch on the Accelerated Master's Degree Program, which leads to a Master's of Science in Environmental Health. This is for the undergraduates from Michigan who are here who may be interested in this as well. It's you earn a Bachelor's of Science from U of M and also a Master's of Science in Environmental Health in 5 years. I'll only mention this to you, that 3+1+1. Please do visit the URL you see at the bottom for more, or email us for more information if you're interested in this. And with an application deadline of January 15th, 2021. But if you are an undergraduate who's in your sophomore year who might be interested in an accelerated master's degree, this would be appropriate for you. The PhD degree will require a research dissertation, highly rigorous quality and quantity of research. And again, this will take about 3 to 5 years. One kind of fun thing about the School of Public Health that I know a lot of students have taken advantage of are the graduate certificates. The graduate certificates are a great way to get additional training in an area in which you're particularly interested. One that's very popular is the Risk Science and Human Health Certificate. So this requires anywhere from 12 to 15 credits, any of these graduate certificates. Selecting from a suggested list of courses. And then when you leave, you have this graduate certificate showing competency in any one of these areas. Again, I think the most popular one at the School of Public Health now is run out of EHS, the Risk Science and Human Health Graduate Certificate. But these are very popular. And again, another way that you can augment your training here and tailor it to your own particular interests. I do a lot of work in global public health, and I'm working a lot with our new center, MGlobe, our new global health center that spans the University of Michigan. And it's always been exciting to me to talk to people about global public health opportunities. I think it's reasonable right here to be a little worried about how you can really do global public health during a pandemic, but now more than ever we need it. I know now more than ever is an overused phrase, but it's absolutely true. And I can tell you that I work with students right now who are using data-driven and other approaches to address global public health problems. We certainly do in the Department of Environmental Health Sciences. You can see here many of the places where our students have completed internships. Most of the work we've done have been in Southeast Asia in my group. And if you're interested in this, there are certainly ways that you can fund this, and certainly people that we can point you to throughout the university who do environmental health in the global context. There's a lot of funding at the University of Michigan as a state school. There's obviously merit-based funding that we are considered in the application process and review. There's graduate student instructor positions, both in the School of Public Health and around the university. Many students take advantage of those. Student research positions. For internships, there's a number of different ways that you can fund these. I'm the most familiar with the global internships. So the Office of Global Public Health in the School of Public Health has dedicated funding for student internships that are abroad, the International Institute. If you are a MS student, Rackham has dedicated funds for internships as well. There's the Graham Sustainability Fellowship, Wallenberg. I mean, a really nice thing about Michigan is the focus on student training and opportunities for students. And of course, there's need-based funding as well. And environmental health sciences has a lot of specific resources that both will help you fund your education, as well as fund resources around you that will make your experience here richer and your ability to do things a little bit easier. So we do, for those of you who are thinking of the PhD program, have the Environmental Toxicology and Epidemiology Training Grant that funds predoctoral and postdoctoral students. Our Life Stage Environmental Exposures and Disease Center is an NIEHS P30 center. Although it doesn't directly fund students, it funds resources and seminars and things around the Department of Environmental Health and links you with people around campus and in the regional area. The University of Michigan Center for Occupational Health and Safety Engineering is a NIOSH Education and Research Center. And there's a number of funding opportunities there for master's students that you'll be considered with during the application process. This kind of makes for a rich environment. When you come here, you definitely get this feeling that you're connected to the greater environmental health community. So I know that there's been a lot of interest, both across the country, across the world, and certainly by students I talk to every week about that involve how you prepare a good application with COVID and with the disruptions given the COVID. And it's a really tough time to be a student. And I feel for each and every one of you. And hopefully here in the Department of Environmental Health and the School of Public Health, we can make this as painless as possible. So we do have prerequisites that you can look on our website that are specific to specific degrees. We know that there have been disruptions. There have been a lot of students did not get grades in the winter semester and are right now not in a situation where they don't tend to get grades. And when we will definitely look at your trajectory of classes. And definitely a good thing would be to highlight your trajectory of classes and how these have, motivated your passion and prepared you for a master's degree. The statement of purpose is incredibly important. So one thing to think about is what your personal professional experiences are that have kind of cultivated your passion for environmental health sciences and why you want to do this. It's important to think about things that maybe you planned to happen that didn't. I've talked to many students who have planned research or training activities to prepare for graduate school and to augment their education that haven't happened. And that's really terrible. But just because it didn't happen doesn't mean that you weren't thinking about it. It doesn't mean you still weren't accepted to a program. So definitely in your motivational statement, tell us about it. It shows your motivation, it shows your direction. And it could be really useful in helping us to decide if this is a good fit for both of us. Letters of recommendation, we've been telling people that this would be a good way for instructors to highlight outcomes of a disrupted course. So if you were in a course that had a heavy online component, a great thing to do if a professor is willing to write you a letter is ask them, like, I was really active in an online forum and in discussions. And this would be incredibly helpful for us in ways when you weren't graded. And I know this is incredibly stressful, and but we're all in this together. And that's one of the only nice things we could say about all of this. We don't require the GRE. So that is not something that you have to worry about. So with that, I know that was a quick 12-minute introduction, but we can take some questions and the whole panel can obviously answer.
Yeah, I think we could talk a little bit more about the research assistantship question because there's a lot more to say about that than I could type very fast. So I think for those, there's a lot of different kinds of options for master's students. Some students get work study in their financial package, or they just reach out to faculty, even if they don't, and say, hey, I want to work, 10 or 15 hours a week. Can I work for you? I'm interested in your research. And people are often happy to oblige. So there's, basically kind of part-time research positions you can get while you're here. And if you're interested in that, you can even just ask around to people whose research you think is interesting. There are also, we do have more formal research assistant packages called GSRAs, which usually only go to PhD students, but I suppose it's, possible to go to master's students, but that probably wouldn't happen until you're here and established and working on a project for your thesis, for instance. We also have teaching positions that we call GSIs. Some schools, they call those TAs. Those also the PhD students are more likely to get, but master's students can apply to them in the School of Public Health or, in the biology department, other places around campus. And some of our master's students have gotten those positions before, and it covers, basically a stipend and your tuition for a whole semester when you're doing that. Does anyone else have thoughts on other kinds of research jobs I missed?
I've known a lot of students who have been really successful getting the graduate student instructor positions in biology, chemistry, and the other departments. You often teach undergrads and work at that level, but it's a good deal and kind of fun. Let's see, more detail about the internship experience, such as where students typically complete their internship, paid versus unpaid, are students typically the driver behind finding internships, etc.
So I can perhaps start. The internship usually is a teamwork, in the sense we have at the level of the school entirely a career service which is helping to find an internship. Second, we have contact as faculty, and we are helping to make this contact. And a great resource is to look at the internship of the previous years. And we organize every year a poster session where the people having done an internship present what they're doing. And we keep also a list of all the internship, which give you a sort of big database to find that. Often we see very regularly people who are taking intern, they often have the intention to test these people and say, oh, it's a nice way to recruit, in fact, without taking the risk to take someone which was not suited for the thing. And for you, it's really a great way to see if you're done for that job, if you really like it and you're motivated, if it keep your passion. And so I don't know if anybody wants to add something.
Yeah, I could speak a little bit to the global internships, because I've helped organize, dozens of the international internships, and it's pretty common for students to be able to find funding that will support them for the entire internship, including the air travel and stay in country. And for the most part, students either find them themselves, and we can help students find them, especially if you're looking at something like the WHO. We can point you to ways that you can look for the more professional internships there, or there can be internships working at health departments in other countries. Otherwise, our career services is just fantastic. I know one of the students, my EHS students I'm mentoring right now, has already found an internship for next summer. I think they range from whether they're paid or unpaid, but I think it's more of a partnership in finding the internships.
Okay, I could chime in here too. There's still time?
Yeah, go ahead for a short comment, then we'll switch to, we have foreseen to have some breakout rooms, just to give you a snapshot that will be short, like 5 minutes per breakout. And you will stay in a breakout room. We will switch the faculty to present you 3 different topics that we have. I let you the surprise. Ted, if you want to speak, Dr.
So this is Professor Zellers. I run the Industrial Hygiene program. And so I'm most familiar with industrial hygiene internships. For the most part, these are obtained with private companies, and they are invariably paid. And we've been running our program long enough that we have many companies that come around soliciting for internships as early as September or October in the fall before the summer that you go out. So we often have lots of options for internships. It works out very well.
Okay, and I just answered the last question, which was on do we have climate change courses? We are in fact just developing new courses which are giving more emphasis in the frame of the specialization on sustainability and health to these aspects. And we have Mary O'Neill, who is an epidemiologist who specializes in the effect of climate change on heat wave. But we have several colleagues, Stuart Batterman, Tim Vonch, who are looking at the prevention, in fact, of the climate change also, and also the adaptation. Okay, so let's, I think, move to the room, to the breakout room. Let's do them like 5 minutes as we are short. And then we'll reconvene and get contact with our students.
Perfect. So I'm going to create the breakout rooms right now so everyone can take a breather for just a couple of seconds. As Dr. Juliet mentioned, we are going to move the faculty from one breakout room to this next room. So participants can sit, relax, and just kind of listen. So I'm going to create the breakout rooms now and enjoy.
Thank you, Rachel. So I think let's use the rest of our time. People are joining back from the different rooms. Let's use the rest of our time for meeting our students. And I don't know what the plan is to, I mean, I think everybody is staying together. We should leave to let our students speak freely. I think, and come back, or you, Rachel, you put us in a breakout room or something like that? No, okay.
The rest of the people are coming back from the third room, and I think we can just stay in the main session and people can ask questions and students can talk about their experience.
Yeah, so perhaps let's have our students speaking about our department. Are they here?
They will be back in just 1 second.
Yep. Okay, thank you. So perhaps could our present students introduce themselves? Who is here?
Yeah, it's
yes.
3 of us here.
Yes, go ahead.
You guys want me to go first then?
Yeah, go ahead. Yeah.
All right. Hi, everyone. I'm Leona. I'm actually one of the IH students, so I'm under Ted in the department. So let's see. The culture, especially for us, is we're actually very close knit. We do a lot of things together. EHS too. I mean, good to see you again, Rachel. We haven't had time, but we do a lot of joint get-togethers. Our student organization is doing a lot of stuff together with EHSA overall. So I mean, we're a pretty small department and we're pretty close, and we all talk to each other and know each other. So we're pretty tight in that sense. I am an MPH student, and I am funded through Rackham as well as a NIASH ERC grant. So, and particularly passionate. I am interested specifically in industry so I plan to be an industrial hygienist and go into industry, mostly manufacturing or mining. So Rachel or Will, do you guys want to?
I can go next real quick. Hi, everybody. My name is Rachel. I'm a 3rd-year PhD student in environmental health sciences. I am in the Illinois lab working on environmental epigenetics projects, in particular looking at lead and neurodevelopment. I know that this is mainly focused on prospective students who are interested in the master's program, but I am here for any PhD-related questions should you have them. And my funding, just very briefly, I'm funded through a couple of different federal grants through the NIEHS. So I can also talk about that process as well, like the environmental toxicology and epidemiology program, which was mentioned earlier.
Thank you, Rachel. I think we have.
Hi, my name is William. I'm a 2nd-year Master's in Public Health student in the Environmental Health Sciences department with a concentration, or a better way to say that is focus in environmental health promotion and policy. I am here at the University of Michigan pursuing public health as a stepping stone to a career in medicine. And so I see public health as a very valuable field, and that it provides me a lot of insight about how treatment can not only be administered to the individual patient, but also how programs can be catered toward entire communities. And right now, some of the research that I'm doing in my capstone project is actually revolved around COVID, and that when COVID first started, it forced everybody inside. And so I'm studying indoor air pollution and houseplants. And so indoor air pollution is 2 to 5 times greater than it is outdoors. And now with everybody spending more time inside, it's become even more problematic. And so I'm looking into plants that can help to alleviate some of that pollution, in addition to just, keeping your windows open or having good circulation in your home.
Thank you. So any question you have, it's your opportunity to ask, especially to our students, I would say. You had the opportunity to ask us.
I have a question for William, actually.
Go ahead.
So I'm also wanting to eventually go into the medical field, and so I was wondering, what did you say? What is your concentration within EHS?
Yeah, so I'll repeat that one more time. So at the School of Public Health, the department I'm in is environmental health sciences, and then my focus is environmental health promotion and policy. You'll sometimes hear that referred to as EHPP for short.
Thank you.
Yeah.
Hi, my name is Kyra Villalon. I actually have a question for Leona.
Go ahead.
Hi, Leona. I also am very interested in joining the Industrial Hygiene program, and I know that you talked about a really tight-knit community between you and faculty there. Just wondering, hypothetically, if I was to be able to join this program and be a member of it, how would you go about inserting yourself or contributing to the community that you guys already have?
You're muted, Leona.
Thanks for that. Sorry. So that's actually an interesting question. So we're actually generally pretty small. So we have a student group, UMISA. And so we have our regular meetings. And then, so last year we ended up actually kind of having a pretty good trivia team going for a bunch of group meetings. I know for those of us that are in Ann Arbor, we'll start trying to have group meetings. We mostly just try to get together, and you sort of just work together on a lot of your classes and in general. So, I mean, you sort of just spend so much of your time with each other that you do become very, very close. But in general, we have a lot of different opportunities, both through our organization, but then as mentioned before, you can join any sort of research and anything for that. So we just have EHS as a whole has a pretty good community, I would actually say.
I think Ted Seller will organize, in fact, a separate session on IH, on industrial hygiene for those interested, and present you a bit more detail about the different options. I think that, so you will receive an email inviting you to that if you're interested.
Thank you.
Yes, indeed. And Kyra, feel free to contact me as well if you want to chat.
He's not that terrible, so no, it's my colleague who takes so much care of his students. It's just beautiful.
Thank you.
And then I'm just going to add that environmental health sciences has a similar program or club organization, however you would like to phrase that, for students as well, and known as the Environmental Health Student Association, or EHSA. And so it's just very similar to what Leona was saying, and that no matter where you find yourself at the School of Public Health, there's always going to be a community or a group of people you can connect with and learn to grow, not only in some of the social activities you may be involved in, as hopefully things open up after the coronavirus, maybe next fall, but also some more academic engagements in which these organizations will bring in outside speakers for you to speak with alumni from the School of Public Health, other outside community members, and really help to solidify your knowledge of the field and make sure that when you do graduate, you can go out into the career field knowing that, okay, this is what I studied, this is kind of where I want to go, and this is how I can get there. And we can help provide you with that knowledge.
As a whole, we really value collaboration. We don't value competition internally. We don't put our grade in percentage. We want that you reach the best quality you can, but we value that people working together. This is really important. Any other question?
I did get a question in the chat from Manon. I apologize if I'm butchering your name. Their microphone is not working, but they asked me if I could elaborate a little bit more about Epid focused or Epid within EHS and what that path might look like. And so I will say very broadly that I'm actually more toxicology focused. I work within the Colosino and Dolinoy labs, which are both very toxicology focused, but I can speak to other faculty who maybe aren't on this call, who are much more Epid focused. The one that comes to mind first and foremost is John Meeker. He does a lot with prenatal exposures and what that means for later life health and adolescent outcomes. And I can also speak to kind of other students within the department and what they've focused on, at least as far as I know. There are a couple different PhD students who work with Dr. Meeker, and he, as far as I am aware, is a wonderful mentor. And then I will make a plug for, again, the ETEP grant, which we do collaborate with both Epid and Tox focused students to organize an environmental health sciences symposia every year, where we invite speakers and we try to have more of like a broad invitation. So we try to stay away from inviting, just toxicology focused speakers or just epidemiology focused speakers and kind of get a good mix. And this also is a great opportunity to kind of, for students to talk about their research because there's a poster session and intermingle with the speakers that we do invite as a networking opportunity. So that was a lot of information and a very broad answer to that question. So if there was anything that you wanted more information on, I'm happy to provide it.
I wanted to just throw out there that as an epidemiologist, I have students from epidemiology and environmental health who have worked in my lab and worked in my group on quantitative and mechanistic projects. And I would definitely encourage anybody who's interested in environmental epidemiology to look at both programs. And I think that one thing, and Jackie and I were going back and forth about this in one of the sessions, so forgive me if if I'm restating something you've already heard, but I think if you were to want to do the type of environmental epidemiology where you could do some coursework on exposure science and toxicology and focus a little bit more on mechanism, I think this might be a pretty advantageous degree for you. It still can be quantitative. I have a master's degree in statistics. All of my students are in R, whether they work in the lab or not. But I think it's just a difference between being more quantitative and being a little bit more mechanistic. But definitely go to both and see what's a good fit for you. Michigan's great. Like I said, I have environmental epi students from epi working in my group all the time. There's a question in the chat that's probably good for you about the EQSH focus and the opportunities that exist in EQSH and useful information about it. You're probably the best person to answer that.
Yeah. Okay. So thanks for asking, Patrick. If you like, EQSH has different pillars. One is the environment, and we have colleagues like Tim DeVonch, who is working on air pollution. So you can focus on that side. On the water side, we have a colleague, Dr. Shuki, who is working on microbiology, and presently, in fact, in collaboration with Dr. DeVonch, for example, they're looking at the COVID. I don't know how you say, concentration of virus in the air inside our buildings and doing a project on that, but has really a whole microbiology lab looking also at antibiotic resistance. That's another area. We have more on the transportation side and Dr. Batterman, who is having several transportation, also housing projects. I'm personally more on the consumer product presently and foods side. And all this, if you like, you will find that in the courses. For example, I'm teaching one class I'm giving presently. I had the exam this morning of my midterm exam of my students on sustainable and healthy products and foods. And that's really bringing the health and the sustainability together there. So for like these different specialty, you will always have a health relation. And also on climate change, I should ask, I should add, we have colleagues who are working, as I was saying, Marie O'Neill on the heat wave side of climate change, but also it touched different of the environmental impact assessment courses and so on. So as Laura was presenting, if you would specialize in that, you would spend about 1/4 of your time in topics related to that to get the required credit to then have that. We are, in fact, presently it's a sort of informal concentration. We are reinstating it, hopefully for the end of this year, for having it as a sub-plan as industrial hygiene is. So is there any advice would you give to a student who wanted to be successful in your program? Are there any pitfalls to be avoided? Students, what is your advice? Because our advice is always from a faculty perspective. Leona, what do you recommend?
Make friends with the others in your program now. There's, as said previously, there's a lot of collaboration. You guys are all going through this together. A lot of this, sometimes one person is good at one aspect of it, someone else is good at another. I mean, these are people that you're likely going to know and speak to well after your degree program is done. Just be ready to reach out. The opportunities are there, and just try to work with your fellow students on it. This is not a competitive sort of program or anything. We very much encourage working with other people. So
I will repeat the same at the faculty level. Don't hesitate 1 second to come and contact us. As we say, we have a relatively high faculty to student ratio, and that means, and I think all the faculty appreciate to have this direct contact with students. It's a bit more difficult just now. On the other hand, we will have regular Zoom session, and that students who want to contact us for research, for their study, if you have a problem, come and speak. That's what we like to do, and I know all my colleagues are really welcoming for that. So that's don't if you something is difficult or you don't understand, don't be shy and come, and we speak of it, we find solution, we help you to find your way.
I could just chime in. I know I'm not a student. I echo what Olivier has said, but just, with environmental health sciences being part of the public health realm in general, I did not get my MPH here. I got it somewhere else in the Midwest, but public health, although there's a lot of practicing professionals, it's a very small world. You'll come to find, you'll run into these people a lot at conferences or in different contexts throughout the rest of your life. So like Leona says, it's very, very collaborative, and it really behooves all of us to really foster this sense of community and collaboration, just because that's how we get things done in public health. So I hope that makes you all feel better if you were like I once was on the pre-med track and stressing all the time. This is going to be a very different environment.
So I'd probably add in there, I just want to throw out this a shout out to Southeastern Lower Michigan, which, as I mentioned, has been my home for a long time. I would tell anybody that came here to make sure that you reach out and see some of the really interesting areas we have here. Detroit's amazing. I mean, and we have a lot of collaborators and a lot of faculty who work in Detroit. Dearborn is one of the most interesting areas in the entire world. It's the largest concentration of people of Middle Eastern descent outside the Middle East. We work closely with the Access Community Center there, which serves the greater Dearborn community, both Middle Eastern and non-Middle Eastern. It has the best food outside of the Middle East. And I've been to the Middle East, and I can tell you, it is amazing. I mean, I think we might just go there this weekend just because now it sounds so good. But I mean, I think a lot of this, if COVID's kind of taught us anything, it's like Michigan's great and there's a lot of pitfalls and things you can do, but make sure you're taking care of all of yourself too. And I think there's a lot of great ways to do that, with Ann Arbor being a small town, but having so much around that you can really enjoy and be a part of, that may actually shape some of the things you end up being interested in.
Yeah, we had a question in the chat. I think since thankfully Rachel's here, since she's part of the committee, might be able to help us answer. Someone asked, I would like to ask how the department is addressing the topic of diversity, equity, and inclusion. What work has been done in or planned to address and/or improve the promotion of a culture with DEI?
Thanks, Aurora. Yeah, so this is an understandably ongoing process. The DEI committee, which I just joined last semester, is currently in a transition period. So we're trying to kind of shift our focus for this upcoming year. And we're trying to employ a more anti-racist lens for the events and the workshops that we organize for the department. And we've got a couple of like really important goals that are in the works. But what we've gotten off the ground this summer was an anti-racism journal club that we're using as kind of an educational opportunity, just to make sure that everybody in the department has the information and is informed enough to kind of have these discussions moving forward so that we can kind of continue to be productive. But moving forward, we're really excited to hopefully be incorporating more environmental justice into the EHS curriculum, and then addressing some other ways in which, from an administrative or a structural standpoint, the EHS department can be more actively anti-racist. We're also hoping to expand our DEI committee. We are one of the smaller departments in the School of Public Health. And so as a result, we do have one of the smaller DEI committees. But we're hoping to get more student involvement in the coming year, because that's where some of like our best ideas have come from in the last few years. So I think that was a rough overview. If there was anything else that you wanted more specifics on, I'm happy to talk more.
Well, I'd just like to add that the DEI committee has been extremely active this past year, sponsoring a number of workshops for all to attend, and a journal club over this past summer that's continued into the fall now, to raise awareness and to bring it center stage in the department. And they've done a great job.
Okay, any other question? I think we'll probably stay here then. We wish you really the best in your search for your career, for where you can serve the world. That's what we are about, serving the world and making a difference. And if we can help you to do that, you are most welcome to join us. If you think you're better in another place, go and serve the world elsewhere. It will be good. Wishing you the best, and we are in contact. Don't hesitate to write me or one of my colleagues or Rachel Yarbrough, who is our student advisor. And we're looking forward to having new contact with you in the future. Bye-bye. Thank you so much for joining.